All right, let's talk about something big that's coming for the U.S. healthcare system at the end of 2025. It's basically a policy cliff, and it's going to have huge consequences for millions of people. Today, we're going to break down exactly what's at stake, and it all starts with one pretty staggering number.
Okay, here it is, 4.8 million. According to the Urban Institute, who ran the numbers, that is how many people they project will lose their health insurance in a single year. Now, to put that into perspective for you, that's roughly the entire population of Louisiana, suddenly without a safety net.
I mean, a 21% jump in the uninsured population in just 12 months. That is not a slow trend. That is a seismic shock to the system. So what on earth is the trigger for this? What could possibly cause this impending crisis?
To really understand the cliff, we first have to understand the lifeline that's about to be cut. Right now, millions of Americans get critical help paying for their health insurance, and it's all through a very specific government program.
That lifeline is called Enhanced Premium Tax Credits. Honestly, the easiest way to think about them is like a discount coupon from the federal government, but for health insurance. Now, these have been around for a while, but they got a major boost. They were supercharged back in 2021 to give more help to more people buying plans on the ACA marketplace.
Now, this table really shows you just how big of a difference these coupons make. That FPL you see there stands for Federal Poverty Level. It's just a government measure for who qualifies for help. But what's really fascinating here is that first row. Look at it. For people making the least, with these enhanced credits, they pay zero, nothing for their premiums. Without them, that safety net is gone. And for the first time, even middle-income folks over 400% of the poverty level get a discount.
And look, this isn't just about percentages on a chart. We're talking about real money in people's bank accounts. This quote from South Carolina just nails the impact. Saving $5, $6, even $700 every single month, that's the difference between having health insurance and not. For a lot of families, that's a car payment. That's groceries for the month. That's rent.
So here's the catch, the big problem. This incredibly important financial help, well, it has an expiration date.
This timeline pretty much tells the whole story. The original credits, they started back in 2010. Then in 2021, they got that major boost. It was so popular, they extended it again in 2022. But here's the key. Each time, it was just a temporary patch, a temporary fix. And now, that final patch runs out at the end of 2025. The policy doesn't get reviewed, it doesn't get phased out, it just stops. That's the cliff.
So the bottom line is this. Unless Congress steps in and passes new legislation, this affordability lifeline just disappears on the very last day of 2025. And when it does, it's going to set off a chain reaction. So what happens when that date hits? Well, the very first domino to fall is the individual. What does it actually mean for a family when that financial support suddenly evaporates?
I mean, why do people avoid going to the doctor in the first place? Research from UT Health laid it all out. And while you see a lot of barriers here, the top two are exactly what you'd guess: cost and a lack of insurance. They are, by far, the biggest reasons people have to make an impossible choice about their own health.
And this data from KFF just shows how powerful that connection is. 30% of uninsured adults had to delay or go without care because of the price tag. For insured adults, that number drops to just 6%. That means being uninsured makes you 5 times more likely to skip necessary medical care simply because you can't afford it. And you know, this directly translates into huge differences in preventative care. Just take a look at these colon cancer screening rates. Among insured adults, almost 2/3 get this vital screening. For the uninsured, less than 1/3. They are less than half as likely to get a test that could literally save their life.
And why does that matter so much? Because delaying those screenings leads to later diagnoses. Look at these survival rates. For colorectal cancer, if you catch it when it's localized, the 5-year survival rate is 91%. If you wait until it is spread, it plummets to just 15%. This isn't just some abstract policy debate. It is, quite literally, a matter of life and death.
But the impact doesn't stop with the individual. A sudden surge in the uninsured population sends shockwaves through the entire healthcare system, and the broader economy, too.
Okay, so let's use South Carolina as a case study again to make this real. That national projection of 4.8 million is so big, it's hard to wrap your head around. But here, you can see the local impact. In just this one state, an estimated 142,000 people are projected to lose their coverage.
So what does that mean for hospitals? This quote from the head of the South Carolina Hospital Association puts it so bluntly. By law, hospitals have to provide emergency care whether someone can pay or not. So when those 142,000 people show up in the ER, the hospital treats them, but the hospital doesn't get paid. This sudden loss of revenue is known as uncompensated care, and it puts an immense financial strain on hospitals. And this is especially devastating in rural areas, where hospitals are often just barely scraping by. Since 2010, 6 rural hospitals have already had to close in South Carolina, creating these healthcare deserts. A huge surge in uncompensated care could absolutely accelerate that crisis.
And the economic fallout is just enormous. For South Carolina, the total estimated cost is nearly $5 billion a year. That's from the direct loss of federal money, the cost of all that uncompensated care that hospitals have to eat, and even costs to employers who just end up with a sicker workforce.
And, just to make things worse, there's another factor. This isn't happening in a vacuum. A lot of the telehealth options that became a lifeline for people during the pandemic, they're also set to expire. So you get this double jeopardy situation. Imagine you live in a rural area. Your local hospital might close, and your ability to see a doctor online could disappear at the same time. It's a perfect storm for cutting off access to care. Okay, so let's zoom out and connect all these pieces to see the full picture of what we're looking at.
What we've seen is that this is not an isolated event. It's a single policy decision that could set off this massive domino effect, from millions of people losing their insurance to individuals having to delay life-saving care, all the way to hospitals facing financial ruin and a multi-billion-dollar hit to a state's economy.
You know, this quote from Martin Luther King Jr. really elevates the whole conversation. It's a reminder that behind all the data, the projections, and the economic models, there's a fundamental question here about fairness and humanity. Access to care isn't just a policy issue, it's a profound moral one. So, we're left with this. We can see the storm on the horizon. We know the exact date it's set to hit, and we've basically calculated the potential damage. This isn't some surprise hurricane. It's a man-made cliff. The only question left is whether anyone will act before we all go over the edge.